Many of you may have seen news stories about a condition called white lung syndrome that's spreading across the United States and the world. And it may not be a coincidence that we saw pneumonia cases first in dogs. White lung syndrome refers to the condition of having a white appearance on an X-ray, and this is caused by damage to the lungs. A normal lung should appear darker in color. And while we may not yet know if the cases in China are caused by the same thing, we have identified what's going on in the United States. There are hotspots primarily in Wisconsin and Ohio right now. Turns out it's a communicable disease caused by a bacteria called Mycoplasma pneumoniae. It's not related to Mycobacterium tuberculosis, although it does have a pretty similar name. It is a gram-negative bacteria that's mostly found in children who don't have well-developed immune systems. Children also don't have the best hygiene. Once a child is infected, it can then progress rapidly in the lungs and cause massive damage that may even be fatal. Fortunately, once identified, it is easily treated by antibiotics. As for dogs as well, there have been positive cases of the same bacteria. Some dogs are easily treated with antibiotics, although others may have something like kennel cough or a viral disease. And there have been reports of antibiotic-resistant Mycoplasma pneumoniae, which can easily be fatal in dogs and humans. So what do we do now? Well, wash your hands, see a doctor if you get sick or your child gets sick, and insist on testing. A lot of doctors will shrug off a sick child if they're not very sick at the time, but I would recommend insisting that they do the assays, not just for COVID, but for different strains of bacteria, including Mycoplasma pneumoniae. But yeah, wash your hands, please.